My name is Kaitlin Kendys. I work in cardiology at Franciscan Physician Network. So the reason that I chose to go into medicine was actually when I was younger, I took care of my mom. She was ill and I was her at-home nurse, which was kind of my first introduction in high school into kind of nursing in the medical field. I instantly fell in love with it and I felt like it was my calling. That is kind of how I ended up in medicine, and I've just continued my career from nursing to nurse practitioner. I chose my specialty. My background has always been in adult acute care, so I worked ICU, critical care, and I fell in love with heart patients, the way the heart works. It's one of the most important parts of our body, and so I just really fell in love with it. The way that I treat my patients is honestly the way that I would want to be treated if I feel like they're part of my family. So I treat them as if it's my grandma, my grandpa, my mom, my dad, my best friend. Everyone deserves that same courtesy, and really it's important to have that relationship with them. The part of my practice that I'm most passionate about, obviously, like I said, is helping people and making that connection. I feel like that's the most important part, but also one of the most rewarding parts is seeing patients do really well, improve, and to help them thrive and strive. So what drew me to Franciscan? So I was in nursing school, kind of just looking for somewhere that I wanted to end up working when I became a nurse. And so I really liked the mission and values. I was like, this sounds like a family. It sounds like a place I would like to be. Over the years, that has become very true. I've worked with so many amazing people in every aspect of where I've worked in Franciscan that they've become my family. So when I'm not at work, I am with my family, which is the biggest thing that's the most important thing to me, is spending time with my family. Spending time with my husband and my 4 children is pretty much where you'll find me doing activities with them, reading a book, or doing some kind of craft, but usually it's something with my family. One of the things that I tell my patients every day, that most of the people in my office would be able to tell you the same, is I tell people to take it one day at a time. What do we need to do today? And that's all we have to focus on. So that's usually my piece of advice I tell patients, and I try and take that myself. Not always easy. Right.